Walk for a Good Cause next weekend and help fund mental health and addiction services one step at a time with Walk to the Lighthouse. It's great to be joined by co-chairs of the Walk to the Lighthouse committee. We have Melanie Walker on the end. We have Sylvia Phelps with us this morning. Good morning, ladies. Great. Thanks for being here.
Thanks.
Quickly, we should say, so Melanie, you've been a social worker at Joseph Brant Hospital for 22 years.
I have.
Man, you must have been young when you started.
12, I told you.
And Sylvia, you were a retired professor of nursing.
That's right, at College.
And how many years were you?
33 years.
Amazing. Yeah. That's wonderful. Let's get to the walk, because this is the 4th year. Let's start with this, Melanie. Why was the walk developed back in 2020?
So I wasn't a part of organizing it that year, but I did attend it, and it was basically family and friends who came together, and it was really about raising awareness. Not so much about funds, it was about raising awareness, reducing stigma. When people have a mental illness, they often suffer silently. They're often maybe too ashamed to or embarrassed to reach out. And so the walk is really a way about getting the word out that it is okay to ask for help, that these needs are important and everyone matters.
Can you tell us about the unit at Joseph Brant a little bit? So you've been there, you know a bit about it.
Yeah, so actually 22 years ago I started on the unit. That was my first position as the inpatient social worker. So it hasn't changed much, and it actually hasn't changed much since it was originally developed in the 60s. So that's one of the big reasons for the need for redevelopment, right? So we do our very best. I think we have a fabulous team. We provide great care, and we have an aging facility. And no private rooms, really, limited number of showers. And so it's really about trying to create a very healing environment and to honor the work that we do, because it's important work.
And we're walking to the Lighthouse, Sylvia. Why are we walking to the Lighthouse, and where is the Lighthouse?
Well, the Lighthouse is symbolic on the other side of the lift bridge, but we're not crossing the lift bridge. But it's more about walking towards a light, walking towards a better, brighter, and clearer future, and staying away from the darkness and the despair that often accompanies a storm.
What's your connection to the walk?
Well, I've started quite a few years ago with the advisory committee at Joseph Brant, and the Equilibrium Burlington, which started, this is the fundraising portion of the walk, or of the advisory committee. We are all people that have lived experience. Either ourselves have accessed the programs, or we have family members that have. So we're very much invested in trying to promote and advocate for better care and services and programs at Joseph Brant, and also knowing and recognizing that not only do we need the help and support for the inpatient and getting a new unit, but we need also outpatient programs like what Melanie's involved in terms of trying to give the tools and the expertise for our loved ones so that they can stay out in the community and not require that constant going back into
It's
the
to
hospital.
prevent admissions, right?
Yeah.
We're running out of time. You have these fancy bracelets that you have in front of us too, that the committee has been making, that people can be wearing on the walk. Anybody can do this walk.
Anybody.
Anybody
No
can do it.
registration fee. We actually just want people walking.
Right. It started with how many people?
There was only 30 people
30.
the first year, and went up to 80 the next year, last year maybe 300, and we're expecting a lot
Okay, so
more.
30 seconds. When is it? So it's Sunday?
September 22nd at 1 p.m. Walk leaves at 2, and we have entertainment and food and prizes.
Right. Walktothelighthouse.com for more information. But as Melanie and Sylvia say, you can just show up.
Just show up.
Okay. And where does it start?
So we're in the parking lot at Joseph Brant, right behind the museum.
Okay. And then you walk towards the Lighthouse.
Yeah.
Thanks for showing us the light and giving us a little light on mental health in Burlington.
Thank you. Thank you.